Rubanda District Assistant RDC Martin Tuliagenda has threatened tough action against health center facilities involved in the embezzlement of supplied medical equipment. He revealed this on December 19th during a one-day district feedback meeting, which was a result of data collection from 8 health facilities in Rubanda District held in the district production hall. The meeting was organized by Kigezi Orphans and Vulnerable Children living with HIV/AIDS KADOLHA in partnership with Mayanja Memorial Hospital Foundation, funded by the TASO Global Fund. Tuliagenda challenged health center facilities involved in embezzlement not to celebrate Christmas by buying themselves luxuries, but rather to buy back the stolen medical equipment. As the representative of the president in the district, he warned that he would carry out more arrests to recover the stolen equipment. He also addressed the issue of health worker absenteeism, which affects service delivery.
But as you say, we are to support your office to make sure that these items are recovered. In charge, please, don't spend too much money this Christmas. Save money for these lost items in respective health facilities. This one, we are not going to compare. This one. Mwikirize omuntu yatemye buzi oyeterate yabana kukenya mabage bihinga abagura tubyo bafitemo kongoma ngo yatemye buzogezi tujiteho of staff obare and fundi. This one is 100% work. Teacher do fundi ya for the money. It's sure, yeah. That one. Then, discrimination. My brother, no staff for me. There is an entire staff there.
Yeah.
Huh? For a moment. We also know that person. So, figure out what collect information. There's been transferred. You see? So, when these issues were raised, I said, and also when you go by your data, you take it 360, and you ended up getting 369. Yes. I would have been worried. Out of 360, if I told you interacted with like 100.
Eli Muchunguzi, the district principal assistant secretary representing the KAO, admitted the challenges of understaffing in health facilities contributing to poor service delivery. Muchunguzi said patients spend over 2 hours at facilities instead of 30 minutes due to understaffing.
One of the biggest challenges is the low staffing in the health centers. Even yesterday we had hospital board meeting. You know, Health Center for is now hospital. So the board meeting was sitting, and it is one of the big issues we looked at. Low staffing levels. You know the problems which are created. Instead of spending 5 minutes on the health center, you find you are spending 2 hours because we don't have enough staff to work after you. But the beauty is, Moko Health Center has been upgraded, and the recruitment process of critical staff is underway. It has started. The District Service Commission is going to sit next week to start the recruitment process of critical staff. You need more doctors, you need more nurses, you need more laboratory technicians, so that when people come for services, you get quick service and then you go. And for the times to come, more staff will be created, because we are seeing there are many people who are interested in working with one. People in the studio, in Chicago, where people are applying for transport service to come and work with us. So when one of us retires, then replacement has to be there.
Amos Tugumisirize, executive director of KADOLHA, reported that their study covered 8 government health facilities, that is Muko Health Center 4, Hamugwa Health Center 4, Ruhija Health Center 3, Bubare Health Center 3, Bwindi Health Center 3, Bufundi Health Center 3, Mpungu Health Center 3, and Ikumba Health Center 3. They found challenges of patients waiting too long for services and accessing CT scans. Their findings showed people living with HIV/AIDS and others seeking health services wait too long, drug stockouts, and limited access to scans.
During our data, we are collecting data from pure HIV, people living with HIV, and even others getting services like TB, malaria services, among others. And among the HIV patients, most of them, we found that they are being delayed because of the low staffing, and there was integration of health services. Thus, they take long to get the medicine. And the challenge of drug stockouts, which is affecting the services of pure HIV. People living with HIV, they was complaining of confidentiality, especially because nowadays the government has introduced integration of services where you find a person living with HIV is on the same line with a person going for malaria drugs. That has affected the quality and the confidentiality of the services being offered to these people living with HIV. My appeal to the government is at least to increase on the services, increase on the staffing levels by increasing the wage, especially in these facilities that are understaffed, so that we reduce the long waiting hours and the long time these clients take at the facility waiting to get the drugs. Then again, and long distance, we have the poor referral system for most of the facilities. If we can have ambulances for these health center 3 and health center 4, it eases the services, especially during delivery for people who travel long distances, and some have complications on the way because of long distances in Rubanda district. And for the scan services, it is my appeal to the government and the local government of Rubanda district, if they can forward this to increase the wage and to increase the staffing levels, so that these services are given the clients than traveling and going to private facilities when they are poor and they don't have access to them. Obuzibu turi kubugana project eje tubire turacollectinga data umuri ba clients kumanya ubuhereza umujyamagara umuri Rubanda district shangire ngo abantu nibatambure ngendo ndingwa munonga kandi bumwe kubaye kamarwariro bacererego bashanga abashaho bari bace munonga kibatwarira kumaraho bwire buringwa bategereze kugira ngo batungo ubuhereza bashanga bumwe basi bahirwariro yabaza kumuhandikira no kumupima bamugira ngo imibazi teriho gendo ze kujigura mu makiliniki ni mu private gatari ka government. Ubwo muntu yija kashaho 2 yahisa shamushanju shamunana ari kutasha 10 kandi yatatini nakajuma kamwe. Ekizibu kiri kugira ngo ba staff ni bace kandi ikindi kizibu kugira ngo bakubari kweza kumukorera ashanga n'imibazi etaro mwene nitushaba government kugira ngo etuyambe abashaho umumarwaro ga government eyongeremo abashaho kugira ngo tucendeze ahashahe z'abarwire bakumara bategereze kutungo ubushaje bino buhereza amarwariro kandi muri Rubanda district batambura engendo ndingwa munonga kandi haco buhereza bwa scan tushangire umukucondoza kwituka KADOLHA tushangire ngo amarwariro gine za scan konka abashaho kuzikoraho gukora hageze scan bino bukugu tibariho ziriyaho ziri aido mwe ntushaba government kugira ngo marwariro nkahamugwa abufundi kandi na mukwere center general hospital ahari izo scan bongere yabashaho bino bukugu kuzikozesa kugira ngo abarwiye bito mu Rubanda district bareke kubona baraza kabare kurondo ubujanje bwa scan kandi tuzine kuyaho zitine abo kuzikozesa.
Prima Nahwela for iTelevision.